And today we'd like to discuss measles. As many of us have heard, cases of measles have been rising across the nation. And we want to talk about what we can do to protect ourselves as people, as a community, and what we can do to make sure that we don't become the site of the next outbreak. And I brought a good team together of health experts, community voices, and I'd like to introduce each one. We have our medical services director, Dr. Shaw Kaikai, also our infectious disease specialist. Next to her, we have Jara Pashal. She is a public health nurse at the Preventive Health Clinic here at the Metro Public Health Department. We have Brenda Haywood. She is a retired teacher, a former Metro Council member, former deputy mayor, and an ordained minister. She's a community advocate. And next to her, we have Kinley Reed. She is an epidemiologist in our Emergency Preparedness Division here at the Metro Public Health Department. And we're just going to go ahead and jump in with a few questions. I'm going to start with Dr. Shaw Kaikai, our infectious disease specialist. Dr. Shaw Kaikai, can you just tell us a little bit about measles, what it is, and how it spreads?
Yes, thank you, Matt. Measles is an infection that is spread by the measles virus. It is highly contagious. 9 out of 10 people that are exposed to measles will contract it. Symptoms can range from having a fever. Typically, someone will have also runny nose and red eyes, followed by a rash, and also fever can get very high. A person is contagious 4 days before the rash develops and 4 days after the rash resolves. A person might be contagious before they're even aware of it. And one thing to know is that measles is vaccine preventable. And also, as far as how it spreads, is that someone who is infected with the measles virus, when they cough, or sometimes even doing some hard breathing into the air, sneezing, anything like that, that puts out the virus in the air, someone else can then contract it, and it's spread that way. The virus can also remain in the air for up to 2 hours once that person leaves that area.
Okay, thank you for that information. Sticking with measles as a virus, can we talk about if is there a cure or a treatment, or are you really treating the symptoms more than anything?
That's a good question. Measles, there is not a cure for it. We try to treat that person's symptoms. So if they're having a fever, can give some anti-fever medication to help bring down the temperature. If the person's having some nausea or some aches, you can try to give them meds to support, keep that person hydrated, and also look for signs of complications. Are they starting to have difficulty breathing, or are they having changes in the mental status that they might need some higher level of care? But again, there's not a cure for measles. We just offer supportive care.
Okay, so supporting is one thing, but preventing it altogether, a lot of times that's the much more effective way of dealing with it. How can we prevent measles?
Measles is a vaccine preventable disease. We have a vaccine that's been around for decades, and it's safe. Usually it's administered when a child is around the age of 1, and then a second dose around the age of 4. It's important even as adults who are not immunized that they get the vaccine. And we having a community that is highly vaccinated will help prevent the spread of measles. And not only that, if someone is infected, it might decrease the severity of that infection.
Okay, so let's stick with that vaccine. Jara, our preventive health public health nurse. So preventing measles with the MMR vaccine. You've been administering lots of vaccines in your day. Specifically with this MMR vaccine, what can parents do? What can parents expect when they bring their kids, or if someone's a little older? What can they expect when they receive an MMR vaccine?
All right, thank you, Matt. When you come into the clinic, We first off sit down with you and we have open communication. We want you to bring questions and we want to give you information that is scientifically backed. And then we sit down and have a conversation where the parent feels really comfortable. And we give them information on that specific vaccine, so the MMR. And we talk about the vaccine and the side effects. And then depending on the how old the child, if it's a child, we can give them information on how to comfort the child, especially, they're afraid. And if the parent comforts them, that helps the vaccine as well. With adults, they come in and we do the same thing. We make sure we have clear communication with the patient, that they understand everything about the vaccine and that it's very safe.
Okay. So going back to what can we expect, what kind of side effects have you observed as a vaccinator, as a nurse? What kind of side effects do you read about and what have you actually observed?
Okay, as far as observing, we don't see it in the clinic unless there was to be an emergency, which I've never seen in all the times that I've vaccinated. So we do tell them that they may go, their child or even an adult may have redness at the injection site. They may have a sore arm, possibly a fever. Not every child or even an adult gets every single side effect. It's just depending on your immune system and how it mounts its response.
Okay. And with that in mind, you've been up close and personal with vaccines for years, and you and your entire family is all vaccinated, correct?
That is correct.
Okay. So what went into that decision for you and for your family?
So I was telling someone earlier today that I don't, as a parent, have a lot of control over a lot of things in my child's life. And what I do have control over is getting them vaccinated to prevent a disease that it's safe and effective. Because I don't know how I'd feel if I didn't vaccinate them and then they got really sick. I just feel like it's the same thing. We have our children wear helmets. They buckle seatbelts. It's the same kind of thing that we really do to take care of our children. So that's why I had my whole family vaccinated.
Okay, thank you, Jara. Ms. Haywood, I'd like to come to you. For some people, getting to a clinic for a vaccine might not always be easy, but that doesn't mean that getting vaccinated is any less important to them. What were you a part of in terms of vaccine access, making sure that it's available to more people?
Thank you for that question, Matt. I served in the Coop administration from 2019 until 2023. And our goal was to leave the city in a much better place than where we found it. And in keeping with that philosophy, all of a sudden in 2020, after we took office in October of 2019, COVID made its way to our United States, okay? So I started taking surveys throughout the city because what I found was many people of color, brown and black people, migrants, there was just a lot of disparities in them becoming vaccinated. And I had the pleasure of meeting Dr. Kai and Dr. Hildreth, and I created partnerships with the health department and with Meharry Hospital. And in taking these surveys, I found out that, number one, they were non-trusting. They didn't believe the information that was being given. So Dr. Kai and myself and other partners, we talked about, and you, Matt, we talked about educating the community, number one, and doing it in a way that they would be trusting. I'm an ordained minister, had a lot of relationships with churches throughout Nashville. So I says, well, the best way is, number one, we had town halls to disseminate the appropriate information and to dispel misinformation. So now they're being educated. So we gave out information and resources and we educated them. Like I said, now it's time for the vaccines to be accessible. So in surveying the community, they said, well, yeah, they're giving them downtown and they're giving the vaccines here, and we're older or we have a lot of kids or whatever. We cannot make it to those places. Okay, we believe in it now, but they're on Murfreesboro Road at the Kmart. We cannot make it to those places. No problem. because we were there to accommodate communities that needed accommodating. So I said, okay, we got you. So we started going around to the churches, the health department, and then we partnered with the Titans also, and we went into the various communities. We said, well, you can't come to us. Guess what? We'll come to you. And that's what we did. And I never will forget the first church we attended was Representative Love's church. And we had almost 300 people that showed up that day. We were just hopeful that we'd have 10 or 15 people. There were 295 people that showed up. And the health department, they sent a crew, and it was just a beautiful thing. But in essence, I probably took the scenic route to answer your question. But in essence, we took the vaccine to them.
It's more accessible,
More accessible.
when you find where someone already is, and you can bring them something that they need, especially when you can also add in the information, good information that they need to make a good decision.
And that's what we did.
So fair to say that making vaccines accessible is an important part of protecting our community?
Unequivocally, yeah, definitely.
Excellent. Good deal. So Kinley, I'd like to come to you. You're an epidemiologist here at the health department. So you kind of look at the broader picture when it comes to health. So the idea of making vaccines more accessible, so more people can get vaccinated. Can you talk about how getting more people vaccinated is a way of protecting ourselves?
Sure. Thanks, Matt. So when we have a larger percentage of our population vaccinated, this helps reduce the overall spread of the virus within our community. So this makes it harder for the virus to infect individuals that aren't able to get vaccinated. So we're talking about infants or those individuals that are immunocompromised. So we call this herd immunity. And so to achieve herd immunity in measles, because it's so contagious, we need 95% of our population or our community vaccinated. The best way to get this immunity and safest way to get the immunity is through vaccination.
Okay. So vaccination can help prevent. We've still seen a good number of measles cases across the country. I believe 4 or 5 in Tennessee, but the vast majority of them have been tied to a specific outbreak, I believe in West Texas. Can you talk about what might make a place more susceptible to an outbreak? A case or two is one thing, but an outbreak is something a little bit different.
Sure. So a community that's more susceptible to outbreaks are those communities that have a lower vaccination rate. So right now, as you mentioned, in northwestern Texas, they have over 400 cases of measles right now. Those MMR vaccine rates in those communities are around, a lot of them, in the 80%. So going back to our herd immunity of reaching that threshold of 95%, they're falling well below that. There are even some smaller communities in the northwestern Texas area that have as low as 46%. And those obviously are the communities that are getting hit pretty hard with the measles cases right now.
So like 80% might sound high, but that's not enough because this virus is just so
contagious. Yes.
Okay. Mm-hmm. So that 95% is
the
not
key,
a magic
yes.
number, but it really that's where
it truly
we see.
is.
Okay. I guess with that in mind, what can we do as a community to prevent an outbreak here? So we're not the next place where there is a large outbreak.
Sure. So protecting our community, we can all get vaccinated, and we can encourage others to get vaccinated. And of course, talking with your medical provider, your infectious disease experts, of all the questions that you have about getting vaccinated. Again, we're talking about reaching that 95% threshold in our community to not only protect us as an individual, but to protect our community.
Okay. So I'm going to turn it back to Dr. Shakaikai, our infectious disease specialist here. So an outbreak, especially a bigger one, that would require a lot of assistance to those who are infected, both on a clinical level, on a broader public health level, with contact tracing, with providing therapies. Can you talk about how, as a department, how prepared we are if we were to see a few cases of measles here?
Yes, thanks for the question, Matt. Here at the Metro Public Health Department, we have been dealing with outbreaks for quite some time over the years. Of course, when the COVID pandemic hit, that was a big educator also. And it taught us that, as Ms. Haywood said, go into the community is important, keeping those community connections, maintaining and continuing to build that trust in public health and in healthcare is important, and we continue to do that each day. And also we know that we cannot do it alone. We need our partners at the state level, the federal level, the community level, to join us in responding to an outbreak. And we make sure to keep those relationships going. But important also, as I said, is to make sure that we keep that trust level up in the community, and that we are a trusted resource, as some of my colleagues have said here. So we're confident here at the health department, if there was to be some cases of measles, that we are prepared with the different tools that are available to us.
And we've seen a few cases in Tennessee, and knowing how infectious this disease can be, preparing as soon as knowing that it has been spotted in Tennessee, our team is prepared and ready to jump in.
Yes, and I would say, if we were to contact someone, say because they've been identified as being exposed to measles, please do answer, and do know that we're only there to do what's best for you and also for your loved ones. We want to make sure that if you're ill, that we can help with what resources you might need, and also then can offer preventive measures for those that might have been in contact with you.
Okay, thank you. Jara, I'd like to come back to you because
Okay.
it sounds like treating symptoms for this, especially as infectious as it can be, would be a big thing. So one of our biggest tools here is this MMR vaccine.
Right.
And I think a lot of the community might well know that MMR is very effective at this. Have you seen a lot more people recently coming and asking about the MMR vaccine or about vaccines in general, just in the past few months since we've been seeing the outbreak in Texas and smaller places where cases of measles might come up?
Yeah, so it's interesting. We haven't had a lot more children come in, but we've had a lot more adults. So adults that are worried that their vaccines have waned and they don't have immunity anymore. We've seen ones that maybe want a third vaccine, or if we do titers. And we don't do titers here at the health department. If you've had two,
And a titer being?
titer is to see how much immunity you have from that vaccine. So, and they probably can give you some more technical.
No, that
Is
sounds
that
great.
good? Okay.
A blood test.
Yes. So, but it's interesting on that. I have a friend who's probably in her late 40s, and she went and got a titer. I'm not sure why, but she said, yeah, it's still really effective. So, there's something to be said. Not that you need to do it, but just believe that, that if you have two vaccines, then you are good. And until they tell us differently, you don't need a third vaccine.
And it's maybe a little unusual you're seeing so many adults, because the MMR vaccine, I don't think we touched on this specifically, it's mostly kids that receive it, right? And
Right.
the first one being about a year. Mm-hmm. And so when are those recommended?
So they're recommended at a year, in 4 to 6 years. When they come into Tennessee, to enroll them in school, they have to have so many vaccines at certain times. So they will get information when they're about to enroll in preschool for that portion. But even when they're little, right after they're born, there's a certain amount of vaccines that they need to have to build those immune responses.
Okay. And for Davidson County residents, where can they go to get vaccinated? I know we're here, but
Yeah, you can go to your regular doctor, but we would love you to come here and see us. We have translators in all different languages. We have people here that can translate for Spanish and Arabic. And then we also have access to other translators. So we want people to know that, just like Dr. Shawkaikai said, that we want to be your trusted partner in this, and that we will answer questions. And if you have a list of questions and you still don't feel comfortable and you want to think about it, okay. We're not here to pressure you into a vaccine, but we're here to highly advocate for it because it is saving lives.
on that note about advocating and trust, I want to turn it back over to Ms. Brenda Haywood.
Okay.
As you're a faith leader, so you do have, you have a large following. How does trust and maybe having a little bit of fun and building trust with people, how does that impact, especially your work in advocating for vaccine access, in advocating for vaccines? Where does trust fall for you?
Thank you, Matt. First of all, I think trust is probably 99.9% of it, because if someone doesn't trust you, they're not going to even listen to you. And first of all, after teaching for probably 35 years and being in the community, I've always been an advocate in the community. And I have to give a shout out to God, because I give him all the glory. And the people in the community, they believe if Ms. Haywood says it's so. And again, I give God that glory. It's nothing to do with who I am or what I've done. It's just what God has placed within me. And most of the people, especially people in the brown and the black communities, they believe in their pastors and they believe in their faith. And, who we are was primarily built on our faith. And they were like, oh my gosh, she's a retired teacher, she's ordained minister, now she's in the mayor's office, and we know Miss Haywood, we can trust Miss Haywood. And they knew, water kind of seeks its own level. And when I met Dr. Shawkaikai, yourself, and others here at the health department, they were humanitarians. They were not just doing a job, they cared. And they know if she's with Miss Haywood, we can believe in that team. And they were very sensitive to the needs of the people. So, and when you talk about herd immunity, I would talk about that. I tried to learn from the specialists, from the experts, and I learned about the 95 and over percentage and what that means to everybody. It's just not you and your household. It's just like the panelists had said, we're trying to save an entire city, state, and the world. We're all connected in that way. So I think it's all about your character, and it's all about integrity, and it's all about how the community views you.
Because you're talking a little bit earlier about when we brought COVID vaccines to the community.
That's right.
And at first there's a little bit of mistrust there.
Oh, yeah.
But there's something to getting good information from a trusted source.
And talking about the mistrust, the reality again is the fact that we as a people have almost been groomed to distrust the system because, as far back as slavery, there's been so much distrust associated with society. And so now we're trying to build on that, and we want to be trusted because of how just the legacy, what has gone on. And so, yeah, trust is very important.
And it's meaningful
Very
for
meaningful.
us. It's meaningful for us to have someone like you work with the system here at the health department to advocate for something that, as you said, some people might be predisposed to have less.
Our trust has really been compromised. So to have people that can, that will be honest and truthful with you, that's very meaningful and very impactful. And disseminating that education and information and dispelling all the misinformation is very impactful and very meaningful. And it's important. I mean, that's what we have to give to society.
Thank you. And I suppose on that note, when you speak with people, you get a good, strong response?
Oh my gosh, yes. They're still calling me, and I'm not in the mayor's office now. And I developed what I call this little packet right here is communities of color, and I would give them out to the churches. And they're still calling on me. Well, where's the health department? We want them to come to our church. I still get those calls. I've shared that with Dr. Kai. Yeah, they're still calling and still wanting us to be a part of the solution because they know we don't want to be a part of the problem.
And Matt, can I add on to Miss Brenda? Yeah. So I was really fortunate to work on the COVID strike team, and we went out to the communities. And when Miss Brenda was there, it was like having a rock star. It was just, but it was a rock star, a spiritual rock star. You know what I mean?
I like that.
A spiritual rock star. So she brought people into the community that may not have ever seen us. And it brought these people, all different people together. And for us, it was really wonderful because we knew we were reaching out to more people and helping people get through COVID. So we loved her.
Thank you. We love you all too.
And that, obviously an initiative that probably helped increase vaccine coverage. Kinley, I'd like to come back to you. Vaccine coverage, sounds like that can be the difference between a case or two and a full outbreak. Can you talk about how we are here in Middle Tennessee, maybe Davidson County specifically? How do we look as far as vaccine coverage?
Sure. So right now in the state of Tennessee and in Davidson County in general, our measles vaccination rate is just slightly below 95%. So we're sitting at about 94.9%, so almost there. We're in Middle Tennessee in general, we're not seeing those low vaccination coverages as we are in the larger outbreak sites. So that is the good news. But unfortunately, we have seen a pretty steady decrease of all immunizations in kindergartners since 2019. So we still have work to do in our community to get above to 95% and above, and it's going to take all of us. It's going to take people like Miss Brenda here in the communities, just doing some community outreach and just, again, getting the truth about vaccines out there and talking about, access to our vaccines.
And especially because you do take a broader look at the numbers. This year, we've in particularly seen a lot of cases nationwide of measles. A lot of them tied to that outbreak in Texas. There was another year recently where we saw an abnormally high number in 2019.
Sure. So in 2019, we had a large measles outbreak up north near New York, New Jersey area. This was due to some unvaccinated travelers traveling to an area in Israel that was experiencing a very large measles outbreak. So unfortunately, they were exposed elsewhere, come back to the United States, and then exposed other unvaccinated individuals. And that resulted in almost 1,000 cases just for that outbreak in 2019. So that was one of the largest outbreaks the U.S. had seen since the early 1990s.
Okay, and that was another case where the community that the measles found was particularly susceptible, being that it was
correct.
A low. Okay.
Yes, so it was within an unvaccinated community, and I believe around 95% of the individuals in that community were unvaccinated.
Okay. Let's talk a little bit more about the vaccine. It was introduced in the 1960s. What did, we see years where there's more cases and less cases. What did it look, we had 1,000 or so in 2019. What did it look like prior to the 60s, prior to the introduction of this vaccine?
So prior to the measles vaccine in the 1960s, when it came available, the U.S. was seeing 3 to 4 million cases of measles a year. So it was not uncommon. We were seeing 300 to 400 cases or deaths every year, and then thousands of individuals hospitalized. So not only were we at capacity with our hospitalizations, but we were also seeing individuals that were suffering side effects from measles. Fast forward a few years, when the measles vaccine was available, we saw a drastic decrease of measles cases within the first couple of years. So by 1970, the U.S. was seeing maybe 100,000 cases of measles every year. And around 1989, there were a few large outbreaks in school-aged children. And so they went back and looked at some other data, did some more research, and decided then that's when the second dose, we recommend a second dose for school-aged children. So by 2000, the U.S., year 2000, the U.S. Had declared measles eliminated. And so now we see on average 200 to 300 cases in the U.S., but again, almost all of those are associated with travel to a country that might have a measles outbreak.
Okay. That's good information. So Dr. Shawkai, I want to come back to you. We've talked a lot about what the virus looks like, how we can prevent it with this vaccine, and what it means on a community level. Do you have kind of a takeaway from today? Is there something do you have a final message you really want the community to hear about measles and about vaccination?
Excuse me. Yes. Again, measles is vaccine preventable. And you've heard my colleagues talk about the safety of the vaccine and how very effective it is. Also, measles can result in complications, hospitalizations, and unfortunately even death. So it's important that we all make sure we're vaccinated and our families and neighbors are vaccinated. I do want to touch on vitamin A, because that's one that has been in the news and we get questions about. We're lucky in that in the U.S. that there is not much vitamin A deficiency. It's very rare for someone to be deficient or low in the level of vitamin A due to the foods that we have access to. And vitamin A is not a treatment or cure for measles. And a person runs the risk of vitamin A toxicity, which can then cause vision problems, even blindness and other neurotoxicities. So we want to make sure that we adhere to measures that have been proven to be effective. And again, treatment is just supportive with getting hydrated and taking anti-fever meds if needed. But be careful with the vitamin A. Again, is a vaccine preventable condition, and the vaccines are safe and highly effective.
Thank you.
Thank you.
Jara, you work with families all the time. What's kind of a final message that you might have for the community, that maybe a family who's considering coming to get vaccinated, what would you like them to hear?
I would like them to hear, come on in and bring your questions. I think, like Dr. Shawkai said, there is a lot of misinformation out there, and we have science-backed information. And we would love to sit down, open that conversation, because we're here to help our community, our children, and we want to be able to answer questions. So you see something, come in and ask us, and we would be glad, like I said, to answer those questions and give you information that we know is a reliable source. So come over to any of our clinics. We are not just here at Lentz, but we're over in East, and we have an Inglewood clinic. So Woodbine. Sorry, don't go to Inglewood. Woodbine clinic. But all of us would love to talk to you. And like I said, we have interpreters to help any language barriers. But come and see us.
And Ms. Haywood, we're really happy you were here to join us. If there's someone who maybe they've got some conflicting information, we've talked a lot about trust. what's kind of a final message that you'd like the community to hear?
Thank you, Matt. First of all, I'd like to articulate that whenever we have any kind of issues in society, and since we're talking about health and vaccines, it's just not up to the epidemiologists or the infectious disease experts, or the nurses, the strike team. We're in this together. And I would like for the community to know, the faith leaders and nonprofits, for everybody to know we're just much stronger when we do it together. We have to assist you all into when we talk about herd immunity. But I just want to also give a shout out to Mayor Cooper, because when his administration started, he told me, I says, well, primarily what's my job as the deputy mayor? He said, we just want to go into the community and see what the needs are, and we want to address the needs. And I was just so happy, because as a minister and as a retired teacher, I wanted to address the needs, because the Bible tells us being a humanitarian and loving people, that's the cornerstone of being spiritual. So I would just like to say to community leaders on any spectrum, if you're a community leader, what that really means is to love people and to impact their lives and using your influence for good.
Thank you very much. And Kinley, you're looking at this from maybe a wider angle. What are you looking at for the coming year? What do you want the community to know about the way we might track this and what we can do?
So again, I'm just going to reiterate about being vaccinated and just having our community reach that 95% threshold. Again, we're pretty close, but it's going to take all of us to talk about it. Science is based on asking questions. So again, as everyone else has said, bring your questions in, give us a call, come by, and let's start the conversation about vaccinations.
Thank you very much. Thank you very much. That's going to wrap up our discussion here. Again, if you do have further questions about measles, about the MMR vaccine, about what we're seeing in the community, feel free to stop by one of our clinics here at the Lentz Public Health Center, 2500 Charlotte, over at our East Public Health Center on Trinity Lane, or at our Woodbine Clinic on Oriel Avenue in Woodbine. Thank you very much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.